Have you ever found yourself in a situation where someone you deeply care about, perhaps a family member, a close friend, or even yourself, absolutely insists that nothing is wrong despite overwhelming evidence to the contrary? This isn't just ordinary stubbornness or willful denial we're talking about here. What if I told you there's a neurological condition that literally prevents the brain from recognizing illness in itself? Today on Bipolar Talks, we're going to explore anosognosia in exhaustive detail. This isn't just surface-level information, but a comprehensive examination of how this condition intertwines with bipolar disorder, why it's so often misunderstood, and what we can realistically do about it. I promise you'll come away from this discussion with insights that could fundamentally change how you approach mental health challenges, whether in yourself or others. Anosognosia explained. Far more than simple denial. When we talk about anosognosia affecting up to 40% of individuals with bipolar disorder, we're discussing something much more profound than someone merely refusing to accept their diagnosis. This is a fundamental neurological impairment where the brain's frontal lobe, the very region responsible for self-assessment and reality checking, fails to properly update the person's self-image to include their illness. It's as if there's a blind spot built into their consciousness specifically for recognizing their own symptoms. The implications of this are staggering when you consider how it affects diagnosis, treatment, and daily functioning. But to truly grasp how significant this is, we need to go back over a century to understand where this concept first emerged in medical science. Historical context: the stroke patients who couldn't recognize their own paralysis. The story begins in 1914 with French neurologist Joseph Babinski, who made a startling observation while working with stroke survivors. Some patients who had clearly lost function on one side of their body would adamantly insist that nothing was wrong with them. This wasn't psychological denial. These patients genuinely couldn't perceive their paralysis. Fast forward to modern neuroscience, and we've discovered this phenomenon extends far beyond stroke victims. Research now shows that between 50 to 98% of people with schizophrenia and about 40% of those with bipolar disorder experience some degree of this awareness impairment, particularly when psychotic features are present. The brain imaging studies supporting these findings reveal actual physical differences in how these brains process self-relevant information. Now you might be wondering, if this looks like denial but isn't actually denial, how can we tell the difference? The distinction is absolutely crucial for how we respond. Anosognosia versus psychological denial, a critical distinction. Psychological denial is a defense mechanism we all use to some degree. It's when part of us knows the truth but chooses to avoid it because it's too painful or frightening to face. Anosognosia, by contrast, is the literal inability to become aware of the deficit in the first place. It's not that the person is resisting the truth. Their brain isn't even presenting them with the truth to resist. This distinction has enormous implications. You can't reason someone out of anosognosia the way you might eventually break through someone's denial. The neurological basis means no amount of logical argument or emotional appeal will create awareness where the brain isn't capable of forming it. This explains why traditional intervention approaches often fail spectacularly with anosognosia patients. When we apply this understanding specifically to bipolar disorder, the consequences become even more profound and concerning. The bipolar-anosognosia connection, a perfect storm of challenges. In bipolar disorder, anosognosia creates what might be the ultimate treatment paradox. The very organ that needs treatment is the one incapable of recognizing that need. This manifests in heartbreaking ways. Patients stopping medications during stable periods because they're convinced they're cured. Individuals in full manic episodes sincerely believing they've never been healthier. Or depressed patients unable to recognize their depression as anything other than normal existence. The fluctuating nature of bipolar symptoms combined with the waxing and waning of anosognosia itself creates a moving target for treatment. Research shows this directly correlates with poorer outcomes, more hospitalizations, higher risk of legal problems, and tragically, greater likelihood of suicide attempts during periods when insight is most impaired. Given how profoundly this affects treatment outcomes, you're probably asking, How do clinicians even diagnose something the patient can't report? The process is more complex than you might imagine. Diagnostic dilemmas. Identifying what the patient can't perceive. Diagnosing anosognosia presents unique challenges precisely because it requires identifying an absence of awareness. Clinicians must rely on careful behavioral observations, collateral information from family members, and sometimes specialized neuroimaging. The evaluation process typically involves assessing whether the patient can accurately describe their symptoms, connect them to a potential illness, and recognize the need for treatment, with anosognosia showing as deficits in all these areas. Complicating matters further, anosognosia exists on a spectrum. Some patients might recognize certain symptoms but not others, or have fluctuating awareness that changes with mood states. This is why brief clinical encounters often miss it entirely, and why ongoing observation by mental health specialists is so crucial. So if someone literally can't recognize they're ill, what treatment options could possibly work? The approaches are more nuanced than you might expect. Treatment approaches. Working around the brain's blind spot. Treating anosognosia requires fundamentally different strategies than addressing psychological denial. The most effective approaches involve 1. Indirect medication strategies. Starting treatment for observable symptoms rather than the diagnosis itself. Let's try this to help your sleep, rather than this is for your bipolar disorder. 2. Therapeutic workarounds. Using cognitive behavioral techniques that don't require illness awareness, but still target symptom management. 3. Family and social support systems. Creating environmental structures that maintain treatment even when the patient's insight falters. 4. Long-term relationship building. Establishing trust with clinicians so the patient may follow recommendations even without full understanding. Now the million-dollar question. If you're dealing with a loved one experiencing this, what can you actually do that might help? The answers require patience and careful strategy. Practical strategies for families and caregivers. When confronting anosognosia in a loved one with bipolar disorder, conventional approaches often backfire. More effective strategies include avoiding confrontational reality checks, which typically lead to defensiveness rather than insight. Focusing on concrete problems the person does recognize, sleep issues, stress, as entry points for treatment. Using team-based approaches where multiple trusted individuals reinforce the same messages. Implementing gentle monitoring systems for medication adherence without being controlling. Practicing radical acceptance that the lack of awareness is neurological, not personal. Before we conclude this deep dive, let's address what might be the most important question of all. Where does hope fit into this challenging picture? The hope in understanding. Why this knowledge matters. While anosognosia presents profound challenges, understanding its neurological basis actually provides a pathway for more compassionate, effective support. Recognizing that a loved one's resistance isn't stubbornness but neurology can transform frustration into patience. Research shows that with consistent, properly tailored treatment, many individuals do regain degrees of insight over time. The key is persistence, proper medical care, and remembering that the person isn't choosing this lack of awareness. Their brain literally can't provide it to them in that moment. If this comprehensive exploration of anosognosia resonated with you, I'd love to continue this conversation. Could you take a moment to like this video if you found it valuable? Your engagement helps others discover this important content. Please share your thoughts or experiences in the comments. Your story might help someone else feel less alone. And if you haven't already, consider subscribing to Bipolar Talks. Mindful for more in-depth mental health discussions. Remember, knowledge is the first step toward meaningful change. Professional disclaimer. While we've provided extensive information about anosognosia today, it's crucial to remember this YouTube content cannot replace professional medical advice. Mental health conditions require personalized evaluation and treatment by qualified professionals. If you or someone you know is struggling, please consult with a psychiatrist or licensed mental health provider who can offer care tailored to your specific situation. As we end today's session, I want to leave you with this thought. Understanding conditions like anosognosia reminds us that the mind, for all its wonders, sometimes needs help seeing itself clearly. Whether you're on this journey personally or supporting someone who has practiced patience with them and with yourself. Until next time, stay mindful, stay compassionate, and keep seeking understanding. This is Bipolar Talks.